You're watching Healthier Environments, a programme exploring ways to improve and protect the public's health. Coming up on the programme, Behind the Screen, highlighting the impact of social media on mental health. You Are What You Eat, the science behind healthy eating. And Moving the Needle, the vaccine heroes helping to keep everyone safe. Hello and welcome to Healthier Environments, a programme from the Royal Society for Public Health and ITN Productions. I'm Natasha Kaplinsky. In this programme, we're going to be exploring current public health issues and initiatives making a difference, from factors in society which influence health and well-being, the importance of social prescribing, to cutting-edge research. Join us as we take a look at some of the revolutionary work taking place to address current global issues in healthier environments. I'm joined now by Shelley Kramer, RSPH CEO. Shelley, lovely to see you again. Thanks for coming in. Another busy year for public health. What would you say have been the key challenges?
I think the key challenges this year have been around mental health and also the issue of childhood obesity. This is not going away anytime soon. It's very complex, it's very multi-sectorial. There's lots of different angles we need to tackle it, and we need to do more quite urgently in that area. So we've been looking at a lot of things like how do you make a healthy supermarket, how do you make a healthier environment. Our Health on the High Street looked at healthier environments and what we can expect and what we should be having. Lots of green space, lots better shops, and lots of things, not having takeaways near schools, for example. So we need to change things around planning as well. So obesity and mental health. We've got lots of issues and social media and young people's mental health, and we've talked about that before, but this year we went a little bit farther and launched an all-party parliamentary group on social media and young people's mental health. We had an inquiry. The inquiry came up with a series of recommendations which are now being looked at by government, and the Online Harms White Paper will pick up some of those recommendations. So we feel that actually we've made some headway with this, even though there's a long way to go.
We've talked in the past, haven't we, Shelley, about social prescribing. Do you feel like you're having any cut through with that? Are you making headway?
So something interesting happened this year in public policy, and that is that the NHS, for the first time in its long-term plan, highlighted the need for social prescribing in every GP area. And that has meant, in a way, that this burgeoning and useful link workers, social prescribers, helping people to get the right kind of services, will actually be strengthened. So a normal social prescribing would be somebody who would, instead of having medication for depression, you might actually go to art courses. If you need support with employability, job readiness, then you can go and get support from a voluntary sector organisation that would help you with that. So really looking at people's lives and saying, what is it that's going to improve your life? And actually social prescribing can really pinpoint the areas, whether you're young, adult worker or older, where those services, those connections you might want to make can be made in your community.
It can be so effective, can't it? If you look at the government's take on things, they seem to be very focused on prevention, certainly if you reference their green paper. Where are you on prevention? Do you feel that's the right strategy?
Well, for the first time, the Secretary of State for Health and Social Care has shown a real interest in prevention by having this green paper on prevention. And of course, we submitted our views, and I think our views were very comprehensive in that the usual things you might expect. We'd like to see minimum unit pricing on alcohol. We'd like to see better labelling. We'd like to see more on the sugar levy, more on reformulation, particularly for children's food that's high in fat, sugar and salt. But actually what we really need to see is focus and investment in communities. So for example, we know from our work last year that the geographic areas in England which are the poorest map closely to what we call the indices of multiple deprivation. And then we know in all of those areas we will see higher levels of obesity, higher levels of poor mental health, less jobs. So all the things that make us healthy and happy, in those areas it's harder. So investment in those areas in all sorts of services, particularly early years. So we've really focused on those social determinants of health in saying to the department what we think should happen.
Let's talk about vaccinations now. Some of what you've just talked about is relevant with vaccinations as well, isn't it, in terms of pricing and all the rest of it. It's often on the news, isn't it, vaccinations? A lot of controversy and huge headway. Where do you feel we're going with vaccinations?
So I think we've made quite a big contribution in that conversation this year. We produced a report called Moving the Needle, which looked at the uptake and public attitudes to vaccination across the life course. And what was really interesting is in this paper, we look at the trends we're seeing. And one of the worrying trends is the fact that young parents, so parents of under 5-year-olds, are seeing a lot of negative activity, a lot of negative messaging on the social media platforms. So we are talking to government with other organisations about the kind of messages that need to be on those platforms. We've talked to Facebook and Instagram and Twitter about having much more positive messaging around vaccination, and also looking at delivery systems. So sometimes we need to be where people are. We need to make it very easy for people to get vaccinated, and we need to answer parents' questions. So one thing we do know from the surveys around vaccine confidence is that often young parents want their questions answered. Is this vaccine effective? Will it make my baby not feel very well for a week? And because we've had a shortage of health visitors, because of austerity, shortage of time spent with a GP or with the practice nurse, lots of people aren't getting those questions answered. So I think there's a mixture of things that we can really get right with vaccinations to get us up to the best, to be the best in the world.
There's always so much to talk to you about, but let's look ahead now and what's going to be on the agenda in the year ahead.
So some very interesting things happening in the years ahead. We've just launched the first ever infection control qualification, and in Wales from next year all tattooists and body piercers are going to have the infection control qualification to get a license. I mean, you probably thought they had that already, but actually they don't. And so one of the things that we're going to be talking about the Chief Medical Officers of Health for the UK is about a licensing scheme for this across the UK, so that wherever you go, it's going to be much safer to have a tattoo or body piercing. The other area we're spending a bit of time looking at is gambling, the issues of debt and mental health and family resilience. But gambling particularly, you'll know it's been in the news quite a lot. There's really progression routes from gaming to gambling for many children, and the evidence is going in the wrong direction. So we want to look at that and say, what is it we need to put in place to make children safe, and also to make it less easy for people to get addicted and to be they're very vulnerable, and what happens is that organisations, the betting companies, prey on them via social media and other ways. So that's a big focus for public health in the future.
Well, we look forward to following that progress with you along the way. Shirley Kramer, thank you.
Thank you.
Social prescribing is a way frontline healthcare professionals can refer people to local, non-clinical services to help individuals take care of their own health. Community referral has been so successful with adults that a new pilot for younger people is underway in the UK. We went to find out how it's helping.
Teenagers and young adults in Brighton could be the first to benefit from state-supported social prescription. Recent studies showed a reduction in the use of NHS services by 80% of adults who'd been referred to a social prescribing scheme. Earlier this year, the government announced nearly £4.5 million for social prescribing. The Royal Society for Public Health has also developed a new framework to help professionals develop their knowledge.
Brighton and Hove is one of the areas chosen to receive government funding as part of a pilot aimed at finding out exactly how social prescription can help young people.
YMCA Downslink Group here is one of 23 organisations across England awarded a share of this funding. They will use it to support a social prescribing scheme within the Children and Young People's Wellbeing Service. Their work covers areas such as mental health, sexual exploitation, housing and counselling.
We know that nationally there is quite a strong evidence base for social prescribing in adults, and that the same thing doesn't really exist for children and young people. And part of this work is that we're looking at how we can sort of provide an evidence base. So our social prescribing role sits within a wider project we have called Mind the Gap. And the value of that project is about ensuring that young people don't fall through the gaps of services.
Social prescribing links non-clinical specialists deploying non-medical solutions with people in need of help.
The patient sees that link worker who finds out what their problems are, what their hopes are, what their expectations are, what their abilities are and what their challenges are, and mixes them all together and then finds something that will take them to a healthier level.
It feels really good because I know that I'm not on my own and I have people that I can talk to whenever I feel that I need help and that I'm struggling.
14-year-old Ellie Mae Vaughan is the sole carer for her mother, who struggles with depression and anxiety and finds it hard to leave the house.
I guess I didn't really have enough time to do some of the stuff I want to do and go out with my friends, because it would be quite hard to just leave my mum at home and do whatever I want without forgetting about her.
Her school realised she was having difficulties and suggested she attend the local young carers group.
I was nervous to meet new people because it's always just been me and my mum. So when they told me that I was going to have to, well, I didn't have to, but I would meet new people who were like me, it was like, okay. And it was just quite nerve-wracking and scary.
She was then referred by young carers to Nikki Inkle from YMCA DLG's Mind the Gap service.
Nikki had been in the week before to our office to tell us about the service, and it just sounded amazing that they were able to allocate someone to work one-to-one.
And Nikki conducted a sort of thorough needs assessment with Ellie about what was going on in her life and what she felt she needed at that point in time.
I guess we just talked about it and how I was feeling, and then we'd talk about if we actually did it, would it make me feel better? And then it would be like, yeah, kind of, it would. And then that just kind of gave me more confidence.
We've been running the pilot now for about a year, and the successes are overwhelming. Like Ellie Mae, who's gone from being at home a lot looking after mum to now being out and about in Brighton, accessing support through the young carers.
She's got a great social group and she's doing what other normal teenagers can do. Goes into town, meets up with friends, and she's a real sort of mentor now at our drop-in groups.
What effect do you think going to young carers has had on you?
I can talk to people, that's a good one. I'm more confident to go places of my own and more confident to talk to people who I know that will understand me. I want to help younger kids like me who are young carers.
Health workers emphasise that social prescription is not about being told what to do.
It's about having that open conversation with them about what they think might help them, and having that positive experience means that if in the future they are struggling, we think they're much more likely to reach out for the support again and ask for help.
Finding new ways to deliver care and support health and well-being is key to keeping people well. Lancashire Care NHS Foundation Trust is looking at new and innovative approaches to educate people and deliver services in the local community. Jonathan Gibson went to find out about these initiatives and to see how they're making a difference.
They called me fat, they called me thick, they told me that I was never going to amount to anything.
Sam wasn't much older than these Year 9 students when he began suffering from depression and anxiety.
My Instagram never used to be how I really was. I used to post that I was happy. I used to post that my life was perfect, but actually behind the screen was a guy that didn't care if he died.
Sam's upfront, honest approach to mental health draws on his own experiences to reach out to young people.
I know the pressures that you guys are feeling.
Change Talks is a 6-week programme he's devised for schools in partnership with Lancashire Care NHS Foundation Trust.
This session is really my lived experience story, so I'll share with them the things I've been through, and then I'll go on to sort of different topics of mental health, so I'll touch on depression, anxiety. I'm going to be talking about self-harm, why the young people do it, and then social media and drugs.
For us as a school, we really wanted to bring Sam in to raise the profile of talking about mental health, and as a young man who's experienced mental health difficulties himself, it's important for us to get the young people to see that it's okay to talk about it, and talking about it breeds resilience. It's trying to be proactive in order to reach our young people before they get the need to go to other services such as the NHS or CAMS. If we can build up resilience and proactive approaches within schools, it just means our young people are equipped to be able to manage their own mental health in the future.
Vincent, Robert and Hannah have all completed the course.
What did you think of it?
We generally hear about mental health and the effects of it on people in our generation, but we don't really hear like the specifics of and examples like Sam gave. So it's really helpful to have those specifics on what it can actually do.
We could relate to him, so it was easier to talk to him.
And is that relatability important?
Well, to echo what these were saying, actually, having someone who's not a teacher is quite a beneficial thing, because it creates a much more sort of personal environment.
Creating the right environment for people to discuss their concerns is at the heart of Lancashire Care's strategy for promoting mental wellness. It's one of the reasons it's invested in this vehicle, to make access to help that much easier.
It provides a real opportunity for us to do two things. Firstly, go out into communities and ask the question about how can we best shape our services to support your community? How can we best support you as an individual? And then secondly, when we're having those conversations, if people want some signposting, some immediate advice, that's great, we can deliver that as well. The world around us is changing really quickly, and I think that we need to be thinking about how do we shape all our services, both those services around early intervention and our acute responses. We really want to try and break down some of the barriers and separations between mental health and physical health.
My Place is another of the projects the Trust supports in conjunction with the Lancashire Wildlife Trust.
What we've done is set up a series of ecotherapy workshops that run across the county that mental health professionals can refer into us, and we'll offer a non-clinical support option for people.
Theo turned to My Place after trying to kill himself.
It just absolutely changed everything, just everything about it, just socialising with people. I don't think I'd be here without My Place, knowing that there's so much more to life than just feeling down.
A message echoed time and time again.
It's had a really big positive impact on my life.
I can't describe enough how much it's helped me over these past 18 months.
It's nice to know that I'm not the only person going through stuff.
I think it's understanding that mental health is something that everybody, and wellbeing is something that everybody can have challenges with at some point in their lives, and it's about kind of building up people's resilience.
And so whether it's Change Talks in the classroom to My Place here in the forest, very different schemes, yes, but with a common purpose: to promote wellness. Schemes that are making a positive difference to lives right across Lancashire.
Vaccines are one of the greatest public health success stories of the 20th century, helping to prevent disease and protect communities. Every day, people all around the world are doing their part to keep us safe through immunisation. Sue Saville went to meet pharmaceutical company MSD to find out how some of these vaccine heroes are helping us stay protected together.
Vaccination is one of the most effective medical interventions ever created for the benefit of public health. The UK has one of the most comprehensive immunisation programmes in the world, supported by everyday people, whom the World Health Organization calls vaccine heroes, those who know the importance of protection against infectious diseases at all ages across the life course. Heroes like nurse clinician Yvonne Gibney, who says reaching a wider cohort may mean changing the culture of immunisation in general practice.
I think vaccine heroes really is a title that can be given to anybody who promotes vaccinations. But maybe those who go just that extra step in acknowledging where the barriers lie. We follow up the non-attenders. We also follow up those that have declined previously, and again share with them the importance of being vaccinated, try to empower them to make a more informed decision. And we have seen a lot of patients who have previously declined now coming forward for those vaccinations.
Information about vaccinations often starts with healthcare professionals in clinics like this. But as communicating the benefits is no one person's, yet everyone's responsibility, so anyone can be a vaccine hero. While vaccination rates in the UK are amongst the best in the world, some decline in uptake must be addressed by remembering the global benefits of immunisation, says the Chief Executive of Public Health England.
The impact of vaccination programmes have been phenomenal, second only to clean water. No other medical intervention has been as important as vaccination in the last 50 years. And globally, every year 2 to 3 million deaths are prevented because of these programmes. And the vaccine heroes are our nurses, our doctors, our parents, our entrepreneurs, the community leaders who are out there, but also those in your family and those that you love. This is about not only protecting ourselves, but protecting each other.
Industry plays its part too, not only by investing in the development of new vaccines, but also by supporting vaccine heroes in delivering health to communities.
At MSD, we believe that we have an incredibly important role to play in the scientific discovery and development of new vaccines. We also believe we have an obligation and an opportunity to partner with the vaccine heroes of the world and do whatever we can to help build healthier communities and use our inventions to really protect population health.
Health inequalities within populations can be addressed by universal vaccination, says Shirley Kramer, Chief Executive at the Royal Society for Public Health. She believes charities can help broaden public understanding of the benefits.
I think charities have a really interesting role to play because we're independent and because we're evidence-based. I think what we can do is provide the questions that many individuals, families, and actually society in general needs answered. And I think we need to talk about community responsibility because, you know, everybody should be a vaccine hero. As champions of public health ourselves, we know that probably one of the greatest things we could do that has the most impact is to increase the uptake rates on all vaccines across the life course.
Charities, industry, the NHS and the government are working together with people in communities, everyday vaccine heroes, who work tirelessly to deliver innovative, potentially life-saving immunisation programmes that will benefit individuals and society as a whole.
Alcohol misuse can have a huge impact on people's health, but also causes a big strain on hospital A&E departments. Spectrum Community Health CIC has developed a hospital-based alcohol liaison service which benefits patients, staff and the wider community. Sharon Thomas went to meet the team.
Life is so good now. I'm so pleased to be here. Life's wonderful.
At her lowest ebb, Fiona Edwards was drinking 3 bottles of wine a day. She has a family, a job, a home, and nearly lost it all to alcohol.
I was an alcoholic. I was drinking far, far too much. and I ended up in hospital twice, and then I just carried on drinking. Totally ruined my life. I was unconscious for 2 days in hospital, and then a doctor came to me and said, if you don't stop drinking, you'll end up dead. And a light went on.
Hello, Fiona.
Hello.
Take a seat. How are you?
Thank you.
After the third time Fiona presented at Pinderfields Hospital's A&E department in Wakefield, she was referred to Spectrum Community Health's Alcohol Liaison Service, or ALS.
Having that shoulder to lean on, just being able to come in once a week and chat about how things are going. They've just helped me so much. I couldn't have done it without them. It's been brilliant.
Patients who present at A&E with alcohol-related issues are referred to the ALS, a team of 2 Spectrum nurses who work with the patient to plan a programme of care. The service offers one-to-one support, which helps patients to explore their relationship with alcohol and work towards positive change.
It's life-changing for these people. A lot of these people don't know where to turn. They turn up to hospital, maybe their last hope for help. We listen to them. We listen to the family, because obviously the family are at the end of their tether as well. We are here to give them that hope that there is life after alcohol.
And when people would reach for water, I'd be reaching for wine.
Patrick used to drink around the clock, sometimes 5 bottles of wine a day. It almost cost him his life.
Eventually it kind of caught up with me. It got so bad that I slipped into a coma. When I came to, they gave me about a 50% chance of actually pulling through. They let my immediate family know, and they kind of feared the worst, really.
The ALS nurses were Patrick's lifeline.
I think I would have found it a lot harder if it wasn't for them. They do offer a really great service. The thing that really shines for them is that they're very, very patient with people. And even when people don't want to listen to their advice, they're absolutely amazing.
Here in Wakefield, the number of alcohol-related hospital admissions has fallen by more than 1/3 over the last 4 years, largely due to this service. It's estimated that saved the local NHS trust around £1.5 million. Spectrum service supports the essential work of the hospital staff.
Previously, when there was no alcohol liaison service, patients presented with alcohol-related problems and had no clear pathway to get the care they needed. Now, when they present, they can go home safely with alcohol liaison service, seeing them at home and telephoning them, or they can be admitted for a shorter period of time where they get the help they need and support once discharged.
The head of the social enterprise that was commissioned to set up and deliver the service says having alcohol liaison nurses within a hospital setting is an essential bridge between the acute setting and the community.
I'm enormously proud of this service. It represents the best in partnership working. Spectrum, working with Mid Yorkshire Hospitals Trust. It's about bringing the skills and competencies of the A&E staff together with the community alcohol treatment nurses. That means better outcomes for patients. It also means seamless care, because patients are moving seamlessly from the hospital discharged into the community.
Fiona has just celebrated her 60th birthday, a day she thought she'd never see. Both she and Patrick have been alcohol-free for a year.
They have helped me enormously, without a shadow of a doubt.
The nurses, without them, I couldn't have done it. They've just been absolutely fantastic.
We all know that a nutritious diet is key to keeping healthy, but to monitor the impact of diet on our health, continuous studies are needed. The Nutrition Society provides scientific, evidence-based research for the public health community, helping to bring nutritional education and change. Donna Bernard went to meet the team.
The Nutrition Society disseminates nutritional science, providing the evidence base for policymakers, healthcare professionals and practitioners.
It's really important when we think about dietary policy or giving some advice to people that it is evidence-based. There is a lot of confusion in the public in relation to what's the best diet for them. And I think it has to be delivered by those that are trained in nutrition.
Well, I'm a nutritional scientist, and what we do as nutritional scientists is research, and then we publish our research after it's been subjected to quite stringent peer review, and publish in journals such as those that the Nutrition Society publishes.
Associate Professor of Obesity Dr. Bernadette Moore's study on breakfast cereals and yogurts led to some surprising results. Many of us still make the mistake of believing that yogurts and cereals are naturally healthy foods. But if you take a look at this label, for example, it has 13 grams of total sugars, of which 8 have been added.
I was really shocked to see how much sugar there is, particularly in cereals targeted to young children and weaning children.
Research studies like this are then shared with government bodies like Public Health England.
Public Health England manages risk. They have campaigns like the Change for Life campaign or Sugar Swaps, where they're trying to influence people's diet. And the Nutrition Society is really important in relation to providing evidence for this.
Professor Parveen Yaqub focuses on the effects of fatty acids on inflammation and immunity.
There's clear evidence that nutrition is important for immune function, because if you look at developing countries and places where there are food shortages, there's a clear connection between malnutrition and the incidence of infections. I've been doing studies testing the effects of fish oil, which is rich in omega-3 fatty acids, on various aspects of immunity and inflammation.
Patients at risk of stroke were given fish oil capsules 2 months before surgery. Then plaque tissue from their neck arteries was analysed after surgery.
The patients who took fish oil had a change in structure of their plaque in the carotid artery, and the indication was that the plaques became more stable in the patients who were taking fish oil compared with those who weren't.
The impact of diet on surgical outcomes is something that's been noted by doctors working on the front line in hospitals.
We're now aware that the minor and major complications from surgery are dramatically reduced if before surgery we can optimise nutrition.
Dr. Nagibi's speciality as a gastroenterologist includes ensuring that patients have the best possible nutritional advice before and after surgery.
I think the Nutrition Society has a wide remit where it can connect those researchers in the field of nutrition and clinicians like myself.
There's a growing feeling that nutrition needs to be a fundamental part of medical training.
I was 4 or 5 years into working as a doctor when I started taking a special interest in nutrition as a subspeciality of gastroenterology, and really it felt like going right to the beginning again, because there just wasn't that background and foundation to build on.
I think it's essential, and that is because it is now apparent that so many of our chronic diseases are directly linked to nutrition, or rather poor nutrition.
The Nutrition Society has a wide remit to communicate robust nutritional science to policymakers, clinicians and healthcare professionals, ensuring the public receives evidence-based nutrition advice. As nutrition and lifestyle-related diseases continue to rise, this could prove essential in helping to manage the nation's health.
The importance of data collection in healthcare has grown through the use of advancing digital technology. The University of Aberdeen uses this technology along with their research expertise to take a leading role in the use of big data for public health issues. Helena Carter went to find out more.
At the University of Aberdeen, they're flying the flag for the use of big data in public health. The data collection, analysis and interrogation carried out here influences guidelines, changes healthcare decisions and impacts policymakers and health professionals across the globe. The Aberdeen birth cohort from the 1950s is a key example of how big data is being used to help answer key public health questions.
The Aberdeen children of the 1950s started in the 1950s with people who were born between 1950 and 1956 and were in school, in primary school in Aberdeen. It captured everybody, so there's around about 12,500 of them. And they participated in surveys, in tests at school, integrated into their lives. They barely noticed it happening to them. And we've continued to interact with the participants ever since then. Now, rather than writing to and asking them to gather data, much of the work we do with them is linking to digital records. So linking to their electronic health record, to blood tests, to medication prescriptions, so we can follow how they're getting on in health.
Bill is part of that cohort. Now in his 60s, his pride at being part of such an influential study is clear.
It's a complete privilege. I'm almost slightly emotional about that. I feel that what the NHS and medical research has done for us in my generation in particular, being one of the first generations after the inception of the NHS, means that we've a lifelong indebtedness to carry on working together. Participation in such things is a responsibility and an obligation that's served with gratitude.
The academic teams work hard here to ensure the research they do reflects the needs of the population and ultimately improve the health of the public worldwide.
We get policymakers to sit up, we get health professionals to sit up, we get patients and public interested in what we're doing. We've had discussions with some of those people who were participants, and they have said to me, as they have to other members of the team, "You've changed my life. Your trial has changed my life. Like, I've got a better relationship with my family, and my business is doing better. This has changed my life." And that is what really good research can do. It can change people's lives for the better. It has to be really good. You need the methods to be well constructed, well presented, so that people trust it and believe it.
And there's belief here in Aberdeen that innovative developments in digital technology can be life-changing, particularly for those who find it difficult to get to a GP.
The benefits of digital technology when it comes to health can be seen right here in this new GP app. So tell me a bit about how you hope this is going to influence lives.
For people with cancer pain, it will help them communicate about what's important to them with their healthcare professionals and GPs, and really help professionals and patients to get the most out of that 10-minute consultation. The key things are the ability for the person with cancer pain to track the painkillers that they're using, to do it very quickly, and to be able to communicate it automatically with their general practitioner. A weekly diary that asks them about more subtle things, for example mood and stress levels, as well as pain and activity and function and things that are important to them.
The value of big data when it comes to public health is immeasurable. The work being done at the University of Aberdeen continues to influence decisions and change lives as they look towards a future that prioritises the health of every single one of us.
Thank you for watching Healthier Environments. We hope you've enjoyed this programme. All of our reports are available to view on the RSPH website. The details are on the screen now. From me and the team here, thank you for watching. Goodbye.